when one steps back and thinks about what Congress is trying to do, one is perhaps astounded at the hubris that's involved, because they are trying to reconstruct, fix and reconstruct 20% of the economy on the basis of legislation that nobody has seen and that has not been tested by the people who know what actually happens in the real world. The legislation that we have seen actually seems to be more of turning rhetoric that has been espoused over the last 20 years into legislation without any intervening thought process or thought or analysis, other than to say this is how it will work, and when there are problems, the administration will solve them. I would like to emphasize one factor, which is that there is a government, there are these intentions and these proposals to have a public option. When you read the legislation, that which we already have, it's really kind of interesting to read it because it says the public option will do this, or this will happen to the public option. Well, an option is not a entity, and it's really hard to figure out how these different things apply to a public option, since an option isn't a thing. They are also saying that there's going to be a level playing field, that the public option will be subject to, will compete on a level playing field. That's the title in, I guess it's the House Tri-Committee bill. However, if you read that provision, it's very revealing, because the level playing field only relates to aspects of that particular subtitle. And it says consistent with other provisions of the subtitle. So anything else in the subtitle which may be inconsistent with level playing field would predominate. But more importantly, it leaves out all of the relevant things that are relevant to competition, i.e. state law and other federal law. Does the public option, as if an option were a thing, does it have to pay taxes? Is it subject to solvency requirements? Is it subject to the antitrust laws? There's a whole long list. But beyond that, I would like to emphasize that these bills, to the extent that we understand what they're doing, have a government takeover of the health care, insurance, and delivery fields, even if there were no public option. They have assumed that since we have these problems, whatever the problems are, the only way to fix them is to have the government take over the insurance and healthcare fields. Federalism is out the window. There would now be federal regulation of insurance, all insurance, not just the public option, but all private insurance. The payment system would be mandated by the feds. The coverage, what would be covered, would be mandated by the feds. And in fact, it would be based on boards or some bureaucrats within HHS. The feds would review every plan's network of providers to make sure that it was adequate. It would require that the reimbursement system pay for what everybody agrees are good things, but for which the mechanisms don't yet really exist, such as coordination of care, education, quality, and culturally sensitive care. How that gets implemented by the federal government is a very interesting question. Comparative effectiveness. Comparative effectiveness, which will be brought in, comparative effectiveness which was in the stimulus bill and which will be brought into any plan that's passed, doesn't by its own terms refer to cost effectiveness, but it is inevitable that when you compare the effectiveness of 2 different treatments, to 5 different treatments, one will get into cost. And that means that they will have to put a value on a life, or on a quality adjusted life year. In England, I think it is $50,000 a year. But my question is, are they going to be explicit about what the value of a life is? And more importantly, is everybody's life worth the same? And are we going to try to make judgments on who gets treatment based upon, or is it going to be based on an average? The questions go on and on. So my point is that this represents a federal government takeover of the field, it will result in the politicization and the bureaucratization of healthcare. There's no question about it. Whether or not aromatherapy is covered will be brought up to Congress. It'll be brought up to HHS. We suggest that there's a simpler and better way to do it, which is we should reform the system that we now have, which discourages individuals from having their own insurance by virtue of the tax system, and encourage, subsidize, assist individuals to have their own insurance and to own it. As it is now, if you work for an employer and you save money, the employer, at least in the first instance, reaps the benefit of those savings. But if people themselves paid for the money with subsidies as necessary to help them do it, they would be much more interested in avoiding unnecessary costs. And it would also provide affordable coverage. One of the major problems, of course, is people changing jobs or being unable to change jobs. If it was based upon their own, if they owned it themselves, they would be able to take it with them. There are, of course, a bunch of questions that arise in trying to do this, but these can be dealt with on a targeted basis and as they arise, rather than the current mindset, which is an a priori effort to fix all of the problems before they even exist, and most of which are made by the regulations that they themselves are doing. Once you start down the road of regulation, you always need another and then another and another regulation. It is inevitable. The group that I work with has prepared a petition asking people to sign that is entitled "Do No Harm," which is let's not change the whole system. Let's focus on what is needed. And this petition says, "Do not do." It is negative. There's a positive element, which is let's do it right and give people the control. Then there's a long list of negatives, which are the things that Congress is now proposing to do. Copies of the petition are available out on the tables, and you can sign up for the petition on the website, which is listed on the petition. We hope that you and your constituents will do so. Thank you very much.